Good morning, everyone, and thank you very much for inviting me to attend this very interesting symposium as a speaker. I'll be shifting the focus somewhat from the main issue, but we'll probably allow non-insiders to better understand the nature of plant derivatives and also to understand what to use in preclinical and clinical trials when complex mixtures are used. The first slide shows a selection of plants that may be relevant in oncology. I define them as edible plants, and if you look at the pictures, not all of them actually are edible, but most of them are edible. If you have a look at the molecular species over there on the right-hand side of the slide, you can see the extraordinary chemical complexity of them, and this leads me to an important concept that I shall try to simplify. Generally, if you look at literature of the past 20 years, you'll doubtless realize the amazing complexity that there is and how difficult it is to understand by botanicals. There are many papers that have been published right down to controlled clinical trials where mixtures, complex mixtures, have been found, many of them on the previous slide, with inadequate standardization. And this represents a bias, perhaps the most important bias, making the data non-comparable between clinical and non-clinical studies. And again, we often talk about isolated compounds, purified compounds. And obviously, the plant origin is almost accidental, as it were. For example, we produce many plant-based cytotoxins, many of which I'm sure you're familiar with. And these are purified, some of them purified molecules, and the purity overlaps with any synthetic substance, although the origin is a plant. But when we speak about complex mixtures, that is quite a different kettle of fish. This slide shows a degree of complexity that I have depicted in this way based upon an extract, a multimolecular substance starting from a plant. You can see that there are many variables that can modify the composition of the entity itself. Today, standardization criteria should be based upon these three pillars: the plant material itself, the plant, the manufacturing process, and then the various controls and inspections required to create the necessary reproducibility for manufacturing. Today, this is in compliance with guidelines that have been accepted both in Europe and in the US that bring together good agricultural practices. In other words, the producers of these substances have to ensure the traceability of the product right down to the final product, and these are the stages that have to be gone through to document quality levels. And there are quality standards that are extremely well defined and precise. And then these have to be, this is the first step, combined with the next stage, which is the actual preparation of the complex mixture, for example, an extract. These are the stages listed in the manufacturing process for a complex mixture, a multimolecular substance, and primarily you can see that there are in-process controls, as I showed you at the beginning, that have to be conducted to guarantee reproducibility. What we say today is that it's a combination, as well as the regulators say, that it's the combination of these guidelines, compulsory guidelines, that should lead, for example, for food supplements, to the preparation of supplements that abide by these quality standards. So the use of GAPs and GMPs, as I showed you before, can permit a highly standardized extract to be produced. And this criterion is the only one that can lead to complex mixtures that may be subjected almost pharmaceutically to preclinical analyses right down to clinical experimentation, as we saw in some cases, presented today. So the development of food supplements, and I'm not going to get into the regulatory side, which would be extremely interesting to explore, but I'm using the word supplementation or integration to define products that are not produced in pharmacological environments. Professor Marco actually mentioned this plant too, and it's a very concrete example. This is the Bilberry, the Vaccinium myrtillus, used commonly in the food industry. It has a wide range of uses to treat peripheral vascular pathologies and also ophthalmological disorders. Complex mixtures have been extracted from this plant starting in the early 70s, and today there are products that are extremely highly standardized. One of them was used by Dr. Darko in her studies, and and obviously the composition of these mixtures is of the utmost importance, and today it's just not possible to consider anything other than highly standardized products in studies such as those that we're talking about. And so the use of derivatives from bilberry